What is a health education specialist? The health education profession is responsible for assuring quality in professional preparation and practice. Responsibilities and competencies of a health education specialist. The skills needed to practice health education and promotion are clearly delineated as responsibilities, competencies, and subcompetencies. The 7 areas of responsibility essentially specify the overall scope of practice for a health education specialist. They provide the general idea of what health education specialists do. Under each responsibility, there are 4 to 7 competencies. A competency reflects the ability of the student to understand. Each competency is further divided into one of 5 subcompetencies. A subcompetency reflects the ability of the student to list or describe. Area of responsibility involves assessing needs, assets, and the capacity for health education and promotion. This responsibility provides the foundation for program planning and planning the assessment process. A needs assessment is a process that helps program planners determine what health problems might exist in any given group of people, what assets are available in the community, and the overall capacity of the community to address the health issues. This is where identifying the existing resources and developing plans for research and data collection begin. Access existing information and collect data related to health. Identify sources of data and critique sources of health information using theory and evidence. Select valid sources of information and identify gaps using theories and assessment models. Establish collaborative relationships and agreements that facilitate access to data. Collect and integrate primary and secondary data, and train personnel and stakeholders and employee ethical standards. Identify and analyze relationships that influence health. Examine relationships among behavioral, environmental, and genetic factors that enhance or compromise health. Examine factors that influence the learning process and the process of health education. Identify and analyze the factors that foster or hinder the learning process and attitudes and beliefs. Determine available health education programs, interventions, and policies. Assess the quality of available programs. Identify potential partners and assess social, environmental, and political conditions that may impact health education. Analyze the capacity for needed health education and assess the resources needed to foster health education. Infer needs for health education based on assessment findings. Analyze assessment findings. Prioritize health education needs. Identify emerging health education needs. And report assessment findings. Area of responsibility 2. Plan health education. Involve priority populations and other stakeholders in the process. Incorporate principles of community organizations. Identify priority populations and other stakeholders. Communicate needs for health education to priority populations. And develop collaborative efforts among those stakeholders and populations. Elicit input from priority populations and obtain commitments from priority populations. Develop goals and objectives and design strategies and interventions. Identify desired outcomes utilizing the needs assessment results. Assess resources needed to achieve objectives. And design theory-based strategies and interventions. Comply with legal and ethical principles. Apply principles of cultural competencies in designing these strategies. Pilot test these strategies. Develop a scope and sequence for the delivery of health education and factors that affect implementation. Determine the range of health education needed to obtain goals. Select resources and use logic models to guide the planning process. Analyze the opportunity and develop a process for integrating health into programs. Identify and analyze factors that foster or hinder implementation. Develop a conducive learning environment. Responsibility 3. Implement health education. Implement a plan of action. Assess readiness for implementation by collecting baseline data. Use strategies to ensure cultural competence in implementing the plans. Use a variety of strategies to deliver a plan. Promote the plan of action. Apply theories and models, and launch the plan of action. Monitor implementations and train individuals involved. Monitor and assess progress in accordance with the timeline and achieving the objectives. Modify plan of action as needed. Select training participants and demonstrate a wide range of training strategies to deliver the training. Responsibility 4. Conduct evaluation and research related to the health education. Design instruments to collect and analyze evaluation, interpret results of the evaluation and research, and apply findings from evaluation and research. Responsibility 5. Administer and manage health education. Obtain acceptance and support from groups for programs. Provide support for individuals who provide professional development opportunities. Explain how program goals align with organizational structure, mission, and goals. Manage human resources and facilitate partnerships and support of health education. Develop volunteer opportunities. Demonstrate leadership skills in managing human resources. Apply human resource policies consistent with relevant laws and regulations. Evaluate and recruit volunteers and staff. Apply appropriate methods for team development, and model professional practice and ethical behavior. Facilitate partnerships in support of health education. Responsibility 6. Serve as a health education resource person. Obtain and disseminate health-related information. Assess information needs. Identify valid information. Critique resource materials for accuracy, relevance, and timeliness. Convey health-related information to priority populations and key stakeholders. Serve as a health education consultant and provide training. Define and establish effective parameters for consulting. Facilitate collaborative efforts to achieve program goals and apply ethical principles. Responsibility 7. Communicate and advocate for health and health education. Assess and prioritize health education and advocacy needs. Identify current and emerging issues that may influence health. Access accurate research related to issues. Analyze impact of existing proposed health policies. Analyze factors that influence decision-making. Identify and develop a variety of communication strategies, methods, and techniques. Create tailored messages using communication theories and models targeted towards priority populations. Incorporate images to enhance messages. Deliver messages using a variety of strategies, methods, and techniques. Engage in health education advocacy and influence policy to promote health and health education professions. Develop an advocacy plan in compliance with local, state, and federal policies and procedures. Communicate the impact of health education on organizations. Incorporate media and technology in advocacy initiatives. Identify significant implications of health policy for individuals, groups, and communities. Advocate for health-related policies to influence decision makers. Develop a personal plan for growth and service. Explain the benefits for participating in health education programs and professions, and serve as a mentor for others. Summary of responsibilities. The responsibilities, competencies, and sub-competencies required for health education specialists do not function independently. They are highly interrelated. All of the responsibilities demand excellent communication skills. Conducting an accurate needs assessment requires research skills to identify and gather appropriate resources. Planning should be based on a valid and reliable needs assessment. When implementing programs, be prepared to serve as a resource person when asked. Evaluation relies on goals and objectives established during the planning process. Coordinating people and administering programs are necessary in planning, implementing, and evaluating programs.